Well, good afternoon everyone, and thank you for taking the time to watch and listen today. Once again, I'm joined by the Minister for Health and Social Care, David Ashford MHK, and our Director of Public Health, Dr. Henrietta Ewart. It's been an unusual few days with the island in the international spotlight following the prosecution of a seemingly lovesick jet skier who took the decision Scotland to the Isle of Man at the weekend. Now, the story captured the attention of news outlets across the world. Whilst many portrayed the story from a romantic or tongue-in-cheek angle, it has certainly piqued the interests of international journalists into our community's success at containing and eradicating COVID-19. Now, we're all for ingenuity here in the Isle of Man, but this individual broke the law and potentially put lives at risk, not least his own. Given the sea conditions at this time of year, things could have ended up very differently, with others being called upon to risk their lives in what could so easily have been a search and rescue, or worse, a recovery operation. This individual arrived on the island with no exemption notice or entry permit. He failed to declare his arrival and also failed to self-isolate. This individual was aware of the law and showed a flagrant disregard when he chose to break it. He went on to mix in packed bars and nightclubs, once again potentially putting lives at risk. It was an incredibly reckless, dangerous endeavour. He has been sentenced to 4 weeks in custody as a result, and I hope this sends a strong signal to others who do not take our laws seriously or who are mistaken in thinking that the rules do not apply to them. I am pleased to say that the circumstances have been investigated and public health are satisfied that there is no wider risk to the public. But we could have been in a very different situation right now had things not turned out the way they did. Upon release from prison, the offender will be taken to the sea terminal where he will be advised to return to the United Kingdom. If he does not return to the United Kingdom, then he may be in breach of our entry restriction regulations and could be liable for arrest and prosecution. Moving on, this week we have seen 3 new cases of COVID-19 detected on the island. I'll hand over to David for a little more detail on these. David.
Thank you, Chief Minister. As the Chief Minister has just said, we've had 3 more cases identified on the island in the last week. All 3 cases are people that have travelled and then been isolated on the island. None of those cases have been out in the community. They've all been isolated and then developed symptoms while in isolation. Sadly, one of those cases, as people will have seen from the news story yesterday, has ended up in Nobles Hospital, and our thoughts go out to their friends and family at this very, very difficult time. They themselves were one of those that developed symptoms while isolating and sadly took a turn for the worse and has required hospital treatment. But I'm sure everyone will join with me in wishing them a speedy recovery. Thank you, Chief Minister.
Thank you very much, David. Turning now to vaccinations. Earlier today we announced that yesterday we received our first batch of COVID-19 vaccine. The vaccine was transported by courier to the island and has been safely transferred to a specialist medical freezer where it will be stored at a temperature of -70 degrees ahead of rollout. The delivery consisted of 2 trays, each one containing 975 doses. Getting 2 trays was crucial for us to be able to begin the vaccination programme. 2 doses are required for the vaccine to be effective. The second dose needs to be given 21 days after the first. As we have to defrost each tray in its entirety, all 975 doses, which must be used within 5 days, we needed the second tray in our possession so that we could be absolutely certain we could provide the second dose at the right time. This means that for any Pfizer jab given throughout the vaccination process, we will always need to be in a position of having the second dose in our possession and on ice ready to administer in 3 weeks' time. We receive our vaccine on a per capita basis through the NHS supply chain. At the moment, we can place an order once a week as batches of the vaccine are released for drawdown. We have ordered our 3rd tray and hope to be in a position to order our 4th tray next week. When this arrives, it means we will have that all-important second dose and we will be able to vaccinate a further 975 people. The first phase of the vaccination will focus on health and care staff, care home residents and workers, and the over 80s. This protects those most vulnerable and our health and care professionals who we rely on to keep our care systems operating smoothly. As I said last week, our aim has been to vaccinate next week or at the latest the 4th of January. At the moment, we are on track to achieve this. It is vital that we do things properly, not quickly. Unlike our neighbours who have commenced vaccinating, we have no community transmission here on the Isle of Man. Administering a vaccine en masse is a complex logistical exercise that requires thorough planning. Preparations are well underway for the training of healthcare professionals, managing the coordination of the vaccinated teams, and receipt of final documentation from the United Kingdom. In the first phase, expected to last 8 weeks, vaccinators will visit care homes to give residents their jabs, while health and care staff will be vaccinated in their workplace or be invited to attend Nobles or Ramsey Cottage Hospital for their jab. Later on in the programme, island residents will be invited to a vaccination hub, as priority groups are called. An area at the Isle of Man airport is being developed to serve as this hub, and work to provide all necessary facilities for staff and patients is now underway. We will, of course, keep you updated on developments. Turning briefly to the situation in the United Kingdom, things there continue to be challenging. Wales has announced it will return to lockdown after Christmas, following a surge in cases. Earlier this week, the pressures that COVID cases are placing on health services came to bear, with every emergency department in Northern Ireland seeing ambulances having to queue with patients. Earlier today, it was announced that some areas of England would see restrictions eased, moving to lower tiers, but some, including London, will see stricter measures imposed. Also this week, it was announced that a new strain of COVID-19 virus has been detected in the United Kingdom. I'd like to invite Henrietta to talk a little bit more about this. Henrietta.
Thank you, Chief Minister. Yes, the new virus has been identified by the COVID-19 Genomics UK laboratory group, which does random genetic testing on positive COVID samples from across the UK. The new strain was first identified in late September, and it's now been found in samples from over 60 different local authorities in England. It now accounts for up to 20% of virus samples tested in East Anglia. It looks as though this mutation has happened in the UK rather than being a virus strain that's been imported from abroad. Now, it's important to remember that viruses mutate naturally as they replicate, and there have already been thousands of mutations in the coronavirus that causes COVID-19. The vast majority of the mutations have no effect on virus transmission or disease severity, but they are useful as a marker to monitor outbreaks and track patterns of spread. The increase in frequency of the new strain in the east of England is associated with the recent rise in cases across the southeast. However, this doesn't mean that the rise in cases is being caused by the new strain. The increasing numbers of the new strain are a cause for concern, and it's being urgently investigated. Meanwhile, it's important to stress that mutations don't necessarily make viruses spread more easily or make them more dangerous. The new strain has mutations to the virus spike protein, which is the target of the 3 current COVID vaccines. However, the vaccines produce antibodies against many regions of the spike protein, so it's unlikely that the changes in the new strain will reduce the effectiveness of the vaccines. Over time, if many mutations that affect the spike protein occur, the vaccines may need to be altered. This is what happens every year with seasonal flu, which is why flu vaccine needs to be given annually. The SARS-CoV-2 virus, which causes COVID-19, mutates at a very much lower rate than flu virus, and the vaccines that are now available can be easily tweaked to protect against new strains if necessary. Thank you.
Thank you very much, Henrietta. One final point I wish to cover before turning to questions from the media are residents returning for Christmas, and in particular our students. Everyone who has returned home has done a fantastic job in following the rules and helping to keep our community safe. Now, I have received messages of concern from some people who are worried that the vigour of youth might mean that returning students would not take the measures we have put in place seriously. These concerns have proven to be unfounded. The fact is, our students have witnessed precisely what it is we are protecting our community from. They have been forced to live in household bubbles, to wear face masks when they leave their accommodation. They have endured prolonged social distancing and lockdown measures, all of which have disrupted their studies and impacted on what should have been one of the most exciting chapters in their lives. My thanks to everyone who has played by the rules and helped to protect our community. And now to questions from the media. And first I have Rob Pritchard from 3FM. Good afternoon, Rob. Faster my.
Faster my, Chief Minister. My first question, just regarding the rollout that you're saying is hoping to start soon. I just wondered, do you have a definitive date on when the first jabs will be administered?
Right, David, do you want to come in on this?
Yeah, we are hoping, Rob, to start on Monday. I do have to put some caveats around that in the fact there is some documentation we are still waiting for from the UK before we can roll it out. We're hoping to have today or tomorrow, and we are putting the staffing rotas now in place, ready to be able to start on Monday as we planned to do and announced a couple of weeks ago.
September to have everyone over 50 vaccinated.
Supply routes come through. To other lines such as Oxford, they're much easier to transport and they're also much easier to deliver as vaccines as well. So that will